Hey, folks. I'm Alan. If you know me, welcome back. If you don't, settle in. Today is Thursday, August 13, 2026, 1:39 in the PM, Davao, Philippines. Uh, I feel like that title for this video is going to be a bit racy. That's too bad. Yay, clickbait. All right, here we are. So I should start this off by saying that Andy and I are okay. Um, some recent events have come up which surprised me. So I thought I'd talk about it. Surgery in the Philippines. Um, in a previous video, I had mentioned that healthcare out here is a bit of a full contact sport. I suppose a more accurate way of putting that is that it can be healthcare here can be abruptly jarring. Is maybe a better way of phrasing that. We had a mutual friend reached out to Andy asking about blood donations. And, like, she can't give blood. Andy's way underweight for that. There's just no shot. I mean, she's under 40 kilos. You have to be at least 55 kilos. Me, on the other hand, my ass has the mass. And as for why this came up, and this is the part I want to dive into, um, is that they need the friend in question needed vouchers. When you go to give blood here, they will give you a voucher, and then you can use that voucher to get a bag of blood for a surgery. Like, no shit. And that's what this person needed. Um, and it like many things here in the Philippines, it caught me off guard. In the U.S., like there's always blood banks are always up your ass to donate blood, and understandably, I have a more common blood type, in demand common blood type, and as a result, I donated frequently when I lived in California. I was part of the Gallon Club. I know. Weird flex. Anyways, it's just I don't get anxiety about needles. At least I don't anymore. I got over it. So I'm willing to get needled. But the circumstances are what caught me off guard the most. This idea that not only is there a shortage of supply here, but there is such a persistent shortage of supply here that if you are trying to mitigate the cost, the expense of that surgery, of that medical event, you need to donate blood and get a voucher. Because a bag of blood here will run you north of 2,000 pesos, so it's going to be over $30 a bag. That's just the blood. That's not counting the needles, the stands, that's not counting the tubing or the labor. Like, that's just the blood. It's going to run you $30 a bag. And in this case, this individual, they needed like 8 bags. It starts adding up fast, especially when you figure the average Filipino here, it makes 10,000 pesos a month, which is $175. All of a sudden, 8 bags of blood, that might be 2 months' wages for somebody, give or take. And that's it was just off-putting. Like, it really gave me some perspective about what I need to think about, in the inevitable event that I wind up having to go to the hospital for whatever reason. Now, fortunately, again, I've got a very common blood type, so I'm not as worried about it. And if you can't find anyone to donate, you can still buy blood. It's just, even when you buy it, the hospital is specifically asking you, hey, go out, find donors. Like, we need to replenish this blood supply. Like, that's how lean it is here. And so just being exposed to that, uh, it just caught me off guard. And I thought, if it catches me, if that surprises me, it's going to surprise other people. So I should talk about it. And then I think, there's another thing when it comes to surgery in the Philippines. And this has been mentioned in other videos, but I would feel like I was not being thorough if I failed to bring it up here. They won't let you leave the hospital unless you pay the bill. If you're in some kind of inpatient care, or if you're trying to like transition to outpatient care, you can't leave until you pay the bill, even if that means that staying an extra night or two increases the bill. you Jack, you aren't going anywhere unless you pull out a magic piece of plastic or a whole bunch of pesos, and you pay what you owe. And a big part of that is because it can be very difficult to track people down here. Like, addresses aren't addresses here. You mostly drive by landmark. And because the governments in the different islands don't necessarily talk to each other, they aren't networked. You can literally just go to another island and just restart life, and the chances are really good that you'll be able to get away with that for like a length of time. Um, Especially if you get out into the provinces. So apparently the medical system here has learned from those errors, and now they won't let you go till you pay that bill. So be advised. Consider yourselves warned. If you're looking at like minor surgeries here, fine. Like dental stuff, super cheap here, well worth it. More serious surgeries, you should really consider, or for more serious medical procedures, I would really recommend you consider what your other options are. Because it's a developing country here. Resources are limited, especially right now. Anywho, that's about it from me. Uh, do you have any experiences, medical, wow, I screwed that up. Any medical experiences here in the Philippines? Um, like, I'm speaking purely from the perspective of somebody in Davao. So I don't know what Manila or BGC or Cebu or Negros is like. I would tend to suspect, I would tend to think that Negros would probably be better because you have so many retirees out that way in Dumaguete. But shit, I don't know. So I'm asking, drop a comment, let me know. Uh, that's about it for me. I'm trying to keep these to once a week just for my mental health. But anyways, as always, folks, take care, be good to yourselves, and stay safe out there. It is a crazy goddamn world. Till next time.